We're live.
Hey guys, it's Dr. Emer. We're gonna have to bring you talk loud and bring you in close. We are now doing Profractional deep erbium resurfacing. So what this does is, this is deep for scars and deep wrinkles. A high coverage area, very deep energy because we want to get him a big improvement. He's a great sport, doing amazing, really wants his scars to improve. If you had a lot of sun damage, if you had a lot of irregular texture, you could also do this treatment. We're doing this on top of the halo to try and get a bigger outcome. And you'll see there's a lot of pinpoint bleeding because we're going really deep. And this is for those that are okay with having a little bit of downtime. Not safe on all skin types, however, unless you do really low density. This is more for a lighter skin tone. This is an ablative laser. And so it's literally burning columns of skin. And to regrow new skin, that's going to be smoother and softer in texture than the scarring he currently has.
What type of numbing is the patient?
So we did nerve blocks and topical numbing. And this you feel a little bit more because we've already done a little bit of laser and deep microneedling.
And how does it feel? Does it hurt?
Maybe a
2 out of 10, he's saying.
yeah, 2 out of 10.
It's definitely worth it.
Lay your head straighter for me. Turn to the right. Yeah, there you go. Perfect. I'm going to come right to the middle here. This is not for the faint of heart. There's a lot of bleeding in this procedure, but it means it's working really well. I usually go into the temple area so it blends the area. In the old days, I used to have the gauze soaked in lidocaine, so it sometimes would be numbing the face at the same time, so you guys could see here. So now what we do, hold this a second. We're going to give him a little gauze. Give him an ice pack like this. Okay, take your right hand up for me, hold right here. It's okay if that's on there, don't worry. Turn all the way to the right. Beautiful. And now we're going to go. So I want to show you guys here a second. You see some of his deep scars there. But take a look up close. You see that honeycombing pattern? All those little dots. Those dots are not scars. Those are the halo. We just created those dots. Those are holes in the skin that are going to heal. So now we're going to start the Profractional right on top.
Is this on a more intense setting than
Yes.
what you would usually do?
Yes, this is. He's lighter skin tone and he's got scarring. Are they asking any questions about scarring or laser?
What is this best combined with?
Well, it depends. Here we did deep microneedling, radio frequency, we did halo. It all depends on the customized plan. For him, we're trying to get scars.
And if you were to do this treatment alone, how would the downtime be? How long would it be?
About 4 to 5 days. but combining it with Halo adds a couple extra days. So he's got a week to play with. So here we are.
Any lasers you recommend for blackheads and reducing pore size?
Pure and Brilliant, our go-to at reducing pores and helping the skin look good without a lot of downtime.
And for those that are just tuning in, we're doing Profractional as part of a combination treatment for acne scars. Right, Dr. Emer?
Yes, we're doing Profractional, just cleaning the lens a little bit. Okay, it's a little dirty when all those dead cells are shooting up. This is on top of the halo. You notice we're spot treating a cosmetic unit, which is his cheek area, because that's where he mainly has the scar.
Is this a good laser for collagen induction?
Oh, tons of collagen production from deep ablative resurfacing. The stronger the laser, the better the collagen production, as long as you don't damage the skin. So that's why you need to make sure when you get lasers done, it's by someone that knows what they're doing.
And usually, do we do microneedling before or after?
Always
using aggressive
after.
laser?
Follow my videos on YouTube. Always after. Never microneedle before.
But we did fractorial with him before. How
But
come?
that's a radio frequency. You didn't ask me that. You asked me microneedling.
Microneedling.
Microneedling radio frequency is always done before because it's deep energy. It's not on the surface. So that's it, you guys, for Profractional. And that's going to do a bunch of collagen remodeling in his scars. And we'll follow him over the next week, okay? And spot treating, helping with the scars, so we can improve results in the next